Thank you. You know, when you're the fifth person to speak, there may be some similarities in what you hear, which I take as a very good thing. I think the world is coalescing around a common view of these set of problems and hopefully a common view in how we approach solving those problems. I am certainly new to healthcare, but like each of you, I'm a consumer of healthcare services. And I'm also a lifelong entrepreneur. In fact, I've had the very good fortune, and it is just good fortune, of building one of those disruptive companies like an Airbnb or an Uber. My life's work has been fundamentally focused on how do you drive a better experience for customers? And where possible, aspirationally, how do you actually improve the quality of life for human beings? So naturally, I have a tremendous interest in how we can leverage technology and some of the more recent advancements in the computing industry to really go drive to address some of the fundamental challenges in the healthcare industry. And I certainly agree with some of the comments that have made. Technology is certainly not a silver bullet, but it can be transformative in how we approach problems. So over the past decade, we've seen an unbelievable number of advances in both consumer and business technologies. Let me give you an example by going back in time about 10 years. More specifically, here's what I'm going to do. I'm going to tell you what I had for lunch 10 years ago today. And this is made possible because of the services that we all use, right? Whether it's Outlook, or it's an expense reporting system, or it's a calendar. I can, in the palm of my hand, click a few buttons and tell you not only what I had for lunch, I can tell you where I had that, who I had that with, and how much I paid for that lunch. But in fact, I tell you what, I can, as a SAP board member, I can click on a couple of buttons on my smartphone and know exactly what our quarterly results were 17 quarters ago by line item anywhere in our P&L. In fact, I could tell you a number of details of my business life for almost any period of time. But ask me when I had my last tetanus shot. Ask me if I'm genetically predisposed to any diseases. Ask me if my insurance covers certain procedures. I not only couldn't tell you those answers, I'd be challenged to find out where I can go get that information. And when you think about that, you look and say, how can that be? How can our world not solve that problem? And I think, in fact, it can. And I'm incredibly heartened to hear some of the commentary we've heard today. We all know that digital technology has transformed many parts of our lives. On the corporate side, sectors such as manufacturing, travel, and retail have seen massive transformation. But when it comes to one of the most central parts of our lives, our healthcare, digital transformation is sadly lacking. In fact, it's very much a laggard environment. Not only does healthcare information continue to be slow and a manual process, in many cases, healthcare data still is analog. And even when it becomes digital, what's interesting is that this is largely siloed. It's largely disconnected and opaque. But here's the thing, becoming digital by itself is not enough. It doesn't solve the problem. Transformation is enabled and is driven by being connected, wherever the data may sit. It's never going to sit in one location. It has to be integrated, and it has to be delivered in real time. Healthcare data on a six-month lag really isn't all that useful. I want it real time. And what's great is technology is available today to actually make that happen. When you think about why it hasn't happened, there are really three things, in my view, that are the reasons why we haven't seen the advancements in healthcare that we'd like to see. The first is, I think the regulatory environment and technology services really haven't aligned on how to deliver value together. Right? It's one thing to look at the regulatory environment and say, hey, look, you know what, we need to improve the access to information. But I think technology companies also have a role to play in how do you how do you deliver trust in how this information is shared and disseminated? I think there are competing interests, like in all industries. There are competing interests with members of the entire healthcare industry. So I'm particularly encouraged with the comments that I've heard today, where we're starting to see the world in a very similar way. There's a third, and it's perhaps just my opinion, but the third reason is that the consumer, the patient, isn't at the center of these initiatives. Not yet, anyways. And it won't advance at the rate of change that we want or the quality of change we want unless the consumer is in the middle of that equation. But here's the thing. Today, I think we're at a tipping point. Right? The same pressures that drive business innovation are now driving the need for solutions, for new solutions in healthcare. And they're very simple pressures: rising costs and the pursuit of value. We're all obviously becoming more aware and more concerned about the increasing cost of healthcare. But we're also more concerned and engaged around the quality of healthcare, which together creates pressure to drive innovation within our system. For technology to be embraced in the healthcare industry, it has to do one thing particularly well. It has to connect to you, the patient, to myself, to you. And that, frankly, is a really high bar. We expect a lot more from technology today than we would have even a few years ago. We want it to work on our behalf. We want it to understand our needs. And we want to be able to deliver tangible results wherever we are. In fact, we expect technology to serve us. Well, to transform the healthcare industry, we can draw lessons from a number of consumer companies. And I'm not going to go through each of these examples, but there are two lessons from companies like an Airbnb or an Uber or Alibaba or whoever you like to use as an example. There are two lessons to learn from them. First and foremost, they put the individual at the center of the equation. In fact, the supplier and the customer are at the center of an Uber experience or an Airbnb experience. The second, and this is fundamentally different than anything we've seen in the last 20 years, they actually leverage open platforms of other companies. And most of the time, you don't even know that's happening. They're actually working and building upon the incredible advancements of others. And that's an incredibly important point. So I believe there are three lessons that are the most relevant to our work in advancing healthcare. First, it has to start with the consumer or the patient. Second, it has to offer transparency and insight by accessing and connecting enormous amounts of data. And third, it's not just about the data. It's how do the applications and services that are built on top of that data actually also get shared and actually be built upon further, right? It's that ecosystem. Encouraging that ecosystem, developing that ecosystem. Without that, the rate of innovation is left to a single company. And I will tell you, and here I'm going to consolidate a number of talking points just so that we can get to the collaborative portion of this. Here, the interesting thing is this. When you look at networks, right, an iPhone, for example, is a really good example of this. An iPhone is an incredible device. But the value of the iPhone is all the applications, all the members of the ecosystem. That's what adds richness to the iPhone. That's what has to happen in any ecosystem play. That's why Airbnb is important. That's why Concur or SAP is important. Because what we do is enable a platform where everyone gets to add value. Now the trick is, how do you add that value in a way that really benefits the individual? And here's what I'd ask us to focus on. The solutions that we deliver have to understand me. And they have to be a very personalized delivery of solutions to me. So when I think about medical data, it not only has to be delivered real time, it has to put me in control of that information. How it's shared, who it's shared with, and frankly, for how long it's shared. Right? I ought to be the sole decision maker on that information. Now, I can see that decision making to my healthcare provider, but on a set of rules that I am comfortable with. It also has to work on my behalf. Right? My mother happens to be a diabetic. Why can't we, on a real-time basis, measure blood sugar, deliver it to an app, and actually change the experience on a daily basis, on an hourly basis for an individual? Right? Changing that behavior is driven by having consumer applications, in this case for healthcare, that are easy to engage with and that drive a behavioral change. Second, I think we have to provide mass transparency into the massive amounts of healthcare data that exist. And I'll leave the details of this to any Q&A that we would like to hit. So the way that SAP is approaching this problem is by delivering a solution we call SAP Health. It is a platform of application services, data services, and identity services that allow not only our company to build and add value on top of that, but for our research partners to build value on top of that platform, our ecosystem partners, and frankly, even individuals who'd like to be able to build value on top of that platform. I'm going to walk you through just a couple of examples of our partners. Last year, we announced a partnership with CancerLink. This is a nonprofit subsidiary of the American Society of Clinical Oncology. The goal of that partnership is to aggregate data from a broad set of cancer patients and make it available to doctors who are caring for similar patients. Over time, and with the permission of those patients, CancerLink will offer anonymized data to researchers and to pharmaceutical companies to help drive targeted advancements in cancer treatment. In fact, this year, we have roughly 1 million records that are now in that CancerLink database. And what we're seeing is let me give you a very specific example. Breast cancer for men, up until this last year, the largest environment where we were able to look at a test case was about 300 patients. In 1 year of the CancerLink product being delivered, we've already exceeded that number. And as more physicians adopt the CancerLink product within the ASCO community, you're going to see that number of records increase to 3, 4, 5 million. And what you're going to find is the capacity to target and deliver optimized solutions around specific use cases becomes, as you would imagine, greater and much more fastly scaled. Let me move over to the Institut Gustave Roussy, or IGR, in Paris, as well as the National Center for Tumor Diseases here in Heidelberg. IGR in Paris has been running a study for the last 5 years called Molecular Screening for Cancer Treatment, or Moscato. And it demonstrates that genome analysis provides clinical benefits for cancer patients. Our project with IGR aggregates data for 1,100 study patients, and this includes text analysis, right, of more than 300,000 documents from patient clinical systems. Right? We're able to bring information together in a model that historically hasn't been possible. Right? Both structured and unstructured information to go drive meaningful, pointed advancements in any number of healthcare areas. Let me just close with the following, and that's the NCT Heidelberg initiative. It's a product that we've developed with NCT called Medical Research Insights. It enables physicians and researchers to securely analyze clinical data from various sources in order to accelerate medical research. And it facilitates the processing of matching patients with the best treatment options and clinical trials. It helps institutes like cancer centers and hospitals improve the accuracy of cancer diagnosis and ultimately patient outcomes. Obviously, we're very pleased to be working with Dean at Stanford. I'm going to close with a request of all of you. I think for us to, as a community, drive the levels of improvements and level of engagement that we're looking for, we have to come together around, in my view, 3 ideas. First, I think we need to work together to update the regulatory environment in a model that incrementally moves forward as we add value, incrementally moves forward in a trusted relationship with the customer, with you and I as patients. But the regulatory environment has to match where technology is. Now, that'll happen over time, but it has to match where technology is. And that will happen as we educate the industry and the market as a whole and bring those 2 environments together. I would ask that we share information and innovation. Without that, there's no way to drive the level of innovation and advancements that we're seeking to achieve. Yes, we can drive it individually, but in my view, what will happen is as platforms become trusted and become open for others to add value, they'll be required to connect to other platforms. They'll be required to come together for the benefit of you and I as human beings. And I'd ask that we seek out partnership opportunities with each other to be able to, again, go to that objective of how do we move faster together than we can on an individual basis. Those are my requests of you. Thank you so much for your time, and let's open up for questions.